Looks like we're live. All right. Don't get the opportunity to fix a lot of things. So we'll see how this turns out tonight. So I hope you guys are having a good night. Nobody's here yet, but you may be logging on and just catching up. So, hey, how's it going? Had a long day, really busy day today. Got to work with the Gons. It was fun. All right. So hope you guys are all having a great evening, enjoying your whole food plant-based dieting, and cheers. Hello. Had somebody came on just a second ago and then left right away, so they weren't happy with what they saw. I can't say I blame them. Let's see. All right. See what's cooking here. Says you guys are here. Hey, Maureen. Hi. How are you? You guys are doing good. Airplay. Okay. Just taking care of some business and stuff. Hey, Seeker, Vanessa, Maureen. How you guys are doing tonight? I hope you're doing well. And I'm just kind of decompressing. Karen, hi. So it's about 7:30. I know there's some politics coming up on TV or something, and I'm not really interested this evening. Arliss, hi. How are you? Carol, hi. How are you this evening? Good to see you guys. Just kind of decompressing on a Tuesday night. Mary Beth, hi. Nice to see you. And so I thought I would log in and see if anybody wanted to chat about anything. Shelley, hi, happy UK New Year. Oh, yes. That's the British spelling of Gilmour, Gilmour. Close, Gilmore is how we use it, but I'm sure that's just an Americanized version. I'm sure when my family came over, they invited them to change the spelling somewhere along the way. Yeah, Chris, nice. Thanks, appreciate that. If you're going to keep doing that, Chris, we're going to ask somebody to block you, and we don't want to have to do that. So, Karen, hi, how are you? And hope you guys have had a great day wherever you are. It's about 7:30 our time. If you're waiting around for the political stuff happening in about a half an hour, and you need to go then because you feel like you need to be caught up with that, then you certainly won't offend me by leaving. Hey, I used to live in Magnolia, Shelley. No, I fasted yesterday. Fasting was Monday for me. Okay, let's see. Somebody do me a favor and block Chris Neal for not being polite this evening. So if you'll block him for me, then I'll make sure that he's not able to get back in and do this because it's extremely rude and I don't like it. I live in Tomball, Shelley. So I'm a big fan of the Tomball Sports Magnet and ginormous system, the Tomball Turtles. I don't have a moderator, but I think one of you guys should be able to click and do that. But I might be able to do it. Hang on for me just a second. I'll see if I can't get rid of Mr. Chris. Sometimes it's difficult to get in and out of some of these areas when you're live. It's really kind of fascinating. Let's see, YouTube Studio. I hope you can still see me. And if you can't, I apologize. But I just, yeah. So I have to go in after the video is complete. Blocked him. Thank you, Karen. Where's my sense of humor? Oh, cute. That's not funny. You know what? I'm going to pick a moderator. If you would like to be a moderator for me, tell me, and I will add you as a moderator to this channel. Just tell me. She's moving back to the UK, selling her house in Magnolia. Vanessa, you want to be a moderator? Thank you. I will add you. Kristen, I'll add you if I can. That's a pretty small name you've got there. Somebody please block him, or I'm going to just cancel the chat and do it again, and because I don't feel like messing with it. It's been a long day. Oh goodness. Oh, you just got hidden. And Kristen, you are now a moderator. And let's see, Vanessa, you are a moderator. Thank you so much. Thank you all. You know, I just want to have a good time and hang out with my friends, and I really don't need, you know, somebody acting like, you know, they need to be the center of the attention. And hey, Mary Beth. Anyway, thanks. That's done. It's all done. Lovely, but my sister is moving back to UK, selling her house in Magnolia. She's lived in Texas for 45 years. Wow. So is she just ready to get back to the UK? Is she just not happy here, or is there a reason, Shelley? I'm curious. And Seeker, you're going to be a moderator too. Everybody's going to be a moderator. So hey, you guys have cool. It changes your name changes to blue with a wrench kind of next to it if you're a moderator. So thank you all for doing that. Appreciate it. No, you guys, hey, we just want to get together and talk and have a good time. Talk about medicine. Talk about vegan eating. Talk about videos. Talk about whatever you all want to talk about. But for me, it's a chance to kind of decompress from the day, and I love hearing the question and hearing your questions and talking to you about stuff. But thanks for showing. Thanks for coming up. And yeah, it just seems like we always get one, right? I don't know why. It seems like lately that's become more of an issue. I guess because we do this more often. Hi, Darla. But I enjoy doing it, and I appreciate you guys for participating with me. So let's have some questions. Something interesting. Something anybody wants to talk about. I can kind of tell you that this was really a very busy day. I had 2 patients in a row that were put in the clinic who had come in with chest pain. And that's always a concern because in a clinic such as ours, we do not have stat labs. Hi, Darla. And the problem with that is we can't effectively rule out chest pain due to coronary reasons. So if somebody is put in the clinic with chest pain, which, by the way, they're not supposed to, if somebody calls and says they're having chest pain, they need an appointment, they're supposed to be directed to an emergency room because it potentially is an emergency. If somebody calls and says they fell and they hit their ribs and that hurts and they need to be seen, that's different. But if somebody says they're having substernal chest pain, difficulty breathing, shortness of breath, pain into the neck or into the left arm, things like that, then that's a sign possibly of acute coronary syndrome, and they need to go to an emergency department. So we had 2 in a row that somehow managed to come in. The first one was a gentleman in his 40s who was otherwise healthy, but it had this on and off chest pain for several days. It sounded kind of like a crescendo angina situation. So fortunately, we were able to do a stress test on him. We do have the ability on some days to do a stress EKG. If you saw the little video I made this morning with the big fella, we call him Igor for fun. But he's gone fishing with me a couple of times, but he does our stress EKGs and a number of other kinds of tests, but he's not there every day. So we were able to go ahead and do a stress EKG and start him on some new medicine, and we felt comfortable with him. And then I had another one that came in right behind him, another gentleman whose chest pain was less convincing. that it was not cardiac in origin. So he was stable. So I sent him right over to a cardiologist's office for a stress echocardiogram. So let's see. Maureen got the turmeric curcumin. Good. Start taking it tomorrow. Remember, it's a systemic anti-inflammatory. You're not going to notice something. That's for long-term health, and it helps reduce inflammation systemically. So take it because it's a good idea to take it, but you won't notice anything, and that's what you want. You want to not notice what it does for you, because what it does is it helps prevent inflammatory conditions, joint pain, things like that. Shelly, you work as a charge nurse in A&E. That's accident and emergency at the UK, I believe, right? A large hospital in Ipswich. Awesome. Well, welcome. Arliss, your son was over and made potatoes. Okay, faux potatoes with cauliflower. Those can be really good. Look just like mashy taters, huh? Sour cream and butter, though. Well, that ruined the whole thing right there. You might as well just had the real potatoes. If you're going to put sour cream and butter on it, that really, takes away the whole food plant-based benefit that you're getting from using the cauliflower. Let's see. You saw it. The Gons told you were weird. Gotta love the Gons. Yep, absolutely. And she's right. I am weird, so I'm okay with that. Well, Shelly, thank you so much for watching our videos. I really appreciate that. Also, if you guys would give me a little feedback, there should be no interruptions on this video. I don't know if when we're discussing live, if you're getting advertisements like, where it blocks me out for a minute and you have to watch 5 seconds and click through an advertisement. If you get something like that, then let me know, because I need to make an adjustment. If you're just getting like a little pop-up thing for a few seconds and then you can click off on it, that's fine. That's not bothersome. Oh, Darla, you lost your 17-year-old niece Christmas Eve. Oh, wow. That's awful. That really is awful. What other medical problems did she have? That's really tragic. 17-year-old young lady. Wow, that's awful. Oh, Vanessa, you did see a little pop-up thing when you first came on. Okay, if you see another one, let me know. Yeah, that's really awesome. I mean, I'm sorry. I meant to say it's really awful. Trying to figure out how something like that could happen on Christmas Eve. Well, you have our prayers and condolences. That's terrible. Just terrible. Well, I hope that we can get some medical answers for the family's sake, and I hope that they will, that if there is something that's hereditary that could affect the family, that they find out. But a 17-year-old with a significant seizure history, sometimes there's more to the story there. So, I hope they get you some answers. Sometimes that can help with the grieving process, but I just couldn't imagine losing a 17-year-old child or nephew or niece. That's awful. Hi, Deborah. Good to see you this evening. I mentioned earlier, to those of you who may be politically minded and want to watch some of the politics supposedly happening this evening, if you leave for that, cheers to you, and you will not offend me by just taking off because you want to go see that stuff. I have very little to no interest in any of that. I find most of it offensive, to tell you the truth. So I don't think we hear the truth. And that's all I'll say about that. So anyway, what else happened today? Wow, super busy. Lots of patients with upper respiratory infections. I had a very nice gentleman in his late 70s who'd been in a few days earlier and seen one of the nurse practitioners. And he came back in because he wasn't feeling better and he'd had some fevers. And I listened to his lungs, and he really sounded sick. It really sounded like he had some infection. I got a chest x-ray, and he had bilateral basilar pneumonia, or what we might call bibasilar pneumonia. So we got him into the hospital. That was this morning. We had another patient that was seen yesterday by one of the nurse practitioners, and lab results came back, and she just wasn't feeling good. Nothing very specific, but her kidney function was almost zero. Her kidney clearance, GFR, glomerular filtration rate, that's hard to say for a Texan, was 6, and her BUN was 40. Her creatinine was almost 7. And so she was an acute renal failure or acute kidney failure. So we had to track her down and get her to the hospital. So that was, we just had a lot of things happening today. You just never know what's going to happen in a primary care clinic, especially this time of year. A lot of people, they don't know how sick they are, and they come in and we take care of them. Shelly, your husband has lymphoma mantle cell, was in remission after auto stem cell transfusion, but he relapsed 2 months ago, and he's now on ibrutinib. Okay, so that's probably one of the newer biological agents, and I'm not familiar with the name. It could be because it's got a different name elsewhere. So you're mainly working night shifts. Well, I hope he does well on this new medicine, and that he gets right back to remission again. And it's true, Vanessa, only God can solve our problems. We can't, we talk about all these different things that people want and what they expect the government to do. And the truth is the government's never going to solve all of our problems. And mankind continues to be evil toward one another for whatever reasons. And we use all kinds of excuses to do it to each other. But I just think it's horrible how we treat one another. Anyway, amazing luck with Meta7 in less than 24 hours for your neuropathy. That is fantastic, Beverly. That's wonderful. Flubbed up and had pasta. Not much, but you're bloated. Yep, cost yourself that today. Well, it happens. We all make mistakes sometimes, right? Just have to remember, don't have regular pasta because they usually put egg and if you have trouble with wheat flour, if you have trouble with that particular product, then you can always go with different kinds of flour. Rice flour comes to mind, or rice noodles, which I do like. Let's see. Yes, it is. Here in the UK, you only qualify for this medication if you have already had one treatment and then relapse. Okay. Yeah, that makes sense. It possibly just has a different name here that I would be more familiar with. But the truth is I don't have a lot of patients that I treat that we prescribe their oncology medications. We typically leave that to the oncologists. We have one of the finest cancer centers in the world, here in the Houston area, and it's called MD Anderson Cancer Center, MDACC, and they are internationally, globally known, and they are fantastic. So it makes no sense for us to not utilize that facility since it's right at our back door. So any patients that we have that we diagnose cancer, we send them right over to get the treatment started, and they are a multi-specialty center. And they do a fantastic job for our patients. So we're pleased that we have that. Well, Beverly, that's just amazing. I'm glad you've gotten the pain relief. I think that's fantastic. You are so welcome. Thank you for taking the Meta7. Let's see, Shelly, you think our system is far better than the NHS, to be totally honest with you. I'll just say that our systems are different. And there are some aspects of your system that work better for your population, and some aspects of our system that seem to work better for ours. But I think that we could probably each look at the other and find ways to improve at home. So I know that Canadians oftentimes will come here to have procedures done because they do tend to end up on a waiting list sometimes. It seems to be easier here for me to get somebody in for a test. It seems like I had a lot of patients in with abdominal pain today, and especially young persons. I had several patients under the age of 20. I know of 3 that had abdominal pain. And so I was able to get CAT scans on all 3 of those scheduled for today. And I know not everybody in the world has that luxury. So that's something I do like about our system. I do also know that there can be parts of our system where there's a lot of waste and there are inequities and things like that. So I've always been in favor of a baseline healthcare coverage system for everybody in America. And the truth be told, I think that in a lot of ways we do have that. I know that sometimes some people fall through the gaps, but I think the majority of Americans, well, first of all Americans have emergency care. If you have any kind of emergency and you go into an emergency room, then they have to treat you whether you have the ability to pay or not. That's law. You know, we have Medicaid for the poor, we have Medicare for the elderly, and sometimes there are people that are sort of in between. They work, but they don't earn enough for a quality insurance plan, and sometimes it leaves them a little bit lacking. So I think that we have room to improve. Yeah, upstate New York, a case of measles. We're seeing more of these measles outbreaks, especially around universities. And I don't know if yours is, it's interesting, Beverly. That would be, I would be interested to know if it involved a college or university of some sort. But because of the fact that the measles, mumps, rubella vaccine doesn't seem to do as well later in life, you know, beyond the initial immunizations earlier in childhood, I think some schools now are requiring a measles vaccine booster before they go to school. But yeah, the other thing is there are a lot of people out there that are anti-vaccine that's sort of propelling some of these outbreaks as well. So let's see. Seeker, woke up with a major headache, and no matter what I do, I still feel so hungry, feel sick. I know from the past it's something to do with my diabetes. If you've had diabetes for a long time, and you have damage to your stomach from the diabetes, gastropathy, then or gastroparesis, pardon me. If you have a gastroparesis where your stomach doesn't function as well as it used to due to the diabetes, then it can make you feel nausea. So are you fasting today, Seeker? Is that what you're doing? Or do you just have the headache and you just feel hungry and sick? There we go. Stop tremors. Wonderful. Binghamton. University of Rochester teacher hospital. Is that, hey Ruler, is that where the outbreak was? Yeah, a non-immunized child with the measles can cause a whole lot of trouble. It really can. I've had some, other people who've come at me with this and trying to get me on board this anti-vaccine crusade, and I simply will not do it. I know that there are problems with vaccines. I know that they are not perfect, but I also know that they save many, many, many more lives than are negatively impacted by the yeah, I saw you did that, Vanessa, that are negatively impacted by the vaccine. And I think that if you're one of those that has a child who's severely injured by a vaccine, no matter what anybody says, it's never going to make you feel right. It's never going to make you happy or content, because it's just a tragedy. And that's an unfortunate part of vaccinating a population. Okay, so super hungry and major headache. Hunger just won't go away. Are you fasting though, Seeker? Did I miss that? If you're fasting and you're that hungry with a headache, well then get yourself a small snack. You don't have to suffer through this. Learning to fast on a regular basis takes time. It's not something that's super easy for people. For some people, for others, it's not so bad. Ruler, yes. Remember I asked if you want a video? Yeah. It'll be a bit camera card ran out of room for the first tow and battery died on the second. Sure. If you want to send it to me, if you'll send me an email, Ruler, I'll send you a link and you can upload it for me. And I'd love to take a look at it. Let me give you my email. So just use that. Okay, so no, you're not fasting. Okay, well, you got to remember I'm talking with a lot of people, so forgive me for that. Okay, so you just have had a headache all day. Well, I'm sorry to hear that. Yes, Vanessa, the power of moderation. Just don't get into a moderator war with all the moderators trying to moderate each other. That would be scary. Well, Carol, I think there's some people that are afraid of vaccines because there is there is an inherent risk. It's small, but there is an inherent risk with some vaccines that once you give a child a vaccine, they may never be the same again. There's also the risk of not giving a child a vaccine, and they're going to catch a horrible disease and die from that, and that's never the same again. And these are facts of life. And I know there are people on both sides. I think the vast majority of people feel like vaccinating our population against these so-called childhood illnesses is a really good idea. I happen to be one of those, but I do recognize that tragedies occur. It's nowhere near the number of tragedies that we see on a daily basis, automobile accidents and things like that take many, 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 many more lives, but people don't spend a lot of time talking about those on the internet. Well, Deborah, take a happy pill. I'm sorry you got irritable. Sometimes we all do that. DW's foot is slowly getting better. She let's see, Gumby Jean was out yesterday and today, but she is going to be back tomorrow. But the DW was going to come in and cover the clinic for us. But at the last minute, Gumby Jean said she'd be back tomorrow, so she's not going to do that. I do have injections scheduled for my occipital nerves in my neck tomorrow, so she's going to be there with me to drive me home. So that should be interesting. Are there any vaccines that you get as a child that should be repeated as an adult? Well, we talk, there are some, first of all, before you go to college, we do a hepatitis B surface antibody check to be sure that the hepatitis B vaccines were effective. If they're not, then we start them on the series again. Typically, diphtheria, tetanus, and acellular pertussis, or what we call an Adacel booster, is indicated. And let's see what else. There are probably more. I let the nurses pretty much handle the vaccines, and I just sign off on them. So if I have somebody that comes in and they're enrolling in nursing school or PA school or something like that, and they need to have those reviewed, I do those with them. But we just go through the list and check them off. And I don't think of can't think of anything more specific than the DTaP, the diphtheria, tetanus, and acellular pertussis. I get a lot of older adults that do come in that are having grandchildren, and they have been informed that if they don't get the pertussis booster, that they will not be allowed around the child. So they come right in and get that pertussis vaccine. So that's important. Let's see. And that's true. Let's see, Shelley. Yeah, that's true also with our schools if they're not vaccinated, unless they have a religious reason not to vaccinate it, and it has to be valid. So it can't be just somebody saying, oh, well, you know what? I don't want my children to be vaccinated. I want them to go to school, but I don't want to be vaccinated just because religiously we don't think it's the right thing to do. It has to be legitimate. So who decides what's legitimate or not? That's not me, but I do know that does occur. Ruler, you have a buddy who's had as a 12-year-old has no vaccine. Older kid is very hyperactive, ADD, ADHD, etc. And they said it started with the vaccines. I don't know. I think there's a lot of information out there about all kinds of nutritional deficits that could be playing into this. And I don't think we really understand when it comes to the spectrum from autism and so forth. But hyperactivity, ADD, ADHD, That's a very interesting topic. I think that in some circumstances, not staying overly focused on one topic could actually have advantages. So I think in certain settings, some people exhibit ADD symptoms, but in other settings they don't. Now, I have some people who have ADD symptoms in all settings, and then they need to be treated. I have other individuals, they'll come in later in life and they say they're mid-30s, they've just been promoted to an executive position somewhere. They can't focus to get their work done, whereas they were in sales before and they never really had that issue. And so they need to be on some medication to help them. They could probably get through without it, but it's a lot easier with the medicine. Sometimes hyperactivity and ADD symptoms has a lot to do with diet. It has a lot to do, we know that those symptoms are exacerbated with a lot of screen time, either with small handheld devices or television. But I'm not aware of any scientific links between hyperactivity or ADD secondary to vaccines. Yes, I mentioned tetanus every 10 years unless sooner. Yeah, I said DTaP, DTAP, the T is tetanus. Let's see, won't be bad, doc. Tetanus every 10 years unless you have an occurrence after 5 years. Yepers, us nurses do them. And I love nurses. You all do a wonderful job of making doctors look good. That's what nurses do the best. Nurses in my office make me look good. When you lose your spleen, it's very important to not wait until you're older to get the pneumococcal vaccines. And now we have two of them. We have the Prevnar 13 and we have the Conjugate 23, also known as the Pneumovax. And these cover different genotypes of the streptococcal bacteria, Strep pneumoniae, which causes a large percentage of bacterial pneumonia. And if you do not have a spleen, you are more susceptible to those kinds of infections. So it's important to get those vaccines. Oh, goodness. And we can get into pesticides and red and orange coloring in food. Here's an idea. How about a whole food plant-based diet? You don't have to worry about pesticides and red and orange coloring. And I am married to the DW, who is an RN as well. That's right. Yep, food colorings have been blamed. I think we probably had ADD or ADHD prior to the 80s, but I don't think it was really recognized. We see it a lot more in boys than girls. And back then it was pretty much, they're just being boys is pretty much how they dealt with it. So now we recognize that there are some kids that simply just don't focus very well and need medication to do their schoolwork. And, you just have this short window of time where we have a whole lot of knowledge that a child has to obtain. And so as a result, treating the ADHD is a good idea. Let's see. Interesting. All he'll eat is Subway, and he's in front of a screen just about every waking hour. Going to relay the info to my friend. Thanks, Doc. You're welcome. Yeah. And yes, Kristen, it is a team effort. Nurses do rock. Beverly, shots hurt, but they're worth it. I get my flu shot every year. That's another thing. I had a patient in today's the first time I've had a patient in 2 months with a flu swab, the instant or immediate flu result positive on a in-office swab. So we've had some other flu patients that have shown up positive for type A flu, but those showed up later on a blood test because I suspected strongly they had the flu even though they didn't have a positive swab. So they benefited from being on the flu medicine, and I guessed right, and it was confirmed 5 days later on a blood test. So it's good to do that from time to time because it helps me stay in tune with what's happening in my community. And when I see patients with those symptoms, if I've had a blood test recently that shows that those symptoms are showing up positive for flu on a blood test, but they're not showing up necessarily positive on the nasal swab, it lets me know that I need to go ahead and treat them for flu. So there you go. Interesting ADD talk. It's the solution going through your muscle that burns and hurts. Rub it around after the shot and move that arm around. I also recommend a Tylenol for that. Suzanne, hi. How are you this evening? Good to see you. Lots of familiar names. You can't say faces, but names. I see some faces. Some of you have little faces on there. Some of you have different faces, right? Different icons. Some have none at all. Most of you have a little picture. They're pretty small for me on this screen. But yeah, it's good to see you. And there's Snoopy, also known as Robin. Hello, Robin. Good to see you this evening. The horse is 18 or 19. I had 22 a minute ago, but some are leaving now to go watch the political stuff. And again, that's absolutely fine if that's what you want to do. Let's see, completely different subject. My opinion of sinus rinses is actually very good. If you have a history of recurrent sinusitis, I think that the nasal flushes, the saline flushes, the neti pot is the name of one that's very popular in this area. And people that get recurrent sinusitis, if I can get them to use a neti pot about every other day or do a good sinus nasal rinse, they'll usually do much, much better and not have anywhere near as many sinus infections, sinusitis, congestion, allergy symptoms, things like that. Cipro is an interesting medication. We need Cipro and levofloxacin. Ciprofloxacin and levofloxacin are fluoroquinolones, and there's another medicine in that category as well. They probably are overused in the United States. They are used often because they are very good broad-spectrum antibiotics. However, we have a couple of problems with the fluoroquinolone family of antibiotics, one of which is we're developing resistance. We're using way too much Cipro and Levaquin for urinary tract infections as first-line treatment, number one. Number two, so we're getting the resistance. Number two, a lot of people will take Cipro and end up with joint and tendon issues. Now, usually if they do have it, most people, it's transient. It doesn't last very long, so they get over it pretty quick and it's not a big deal. But every once in a while, somebody will take a Cipro and they'll end up with a tendinitis problem and maybe even more than one joint that will go on there, go on for quite a bit of time. So I feel like for me, I usually start with, when we're talking about upper respiratory infections like sinusitis or an acute otitis media or even a tonsillitis, I will either start with a penicillin-based antibiotic such as Augmentin or amoxicillin. I'll use macrolide antibiotics such as azithromycin or Biaxin, which is also known as clarithromycin. I'll use those. And I also use the sulfa drug, sulfamethoxazole trimethoprim. So I'll use those. So if we get a culture back and it shows that we need to change the antibiotic, and one of the only agents that the infection is sensitive to is a fluoroquinolone, then I'll come back and I'll switch to the fluoroquinolone. But I try not to use those first line. Let's see. You got a Nazi pot. I don't think you got a Nazi pot, Ruler. I think you got a neti pot, maybe. It's pretty funny. Neti pot. Sorry, I thought that was funny. Yeah, some doctors are hung up on Z-Paks. It's easy. Ceftriaxone is an effective antibiotic for a lot of things. It's not effective for atypical bacterial infections such as mycoplasma, which we often see in upper respiratory infections, simply because ceftriaxone works similarly to penicillins in that it attacks the cell wall. And if you have a mycoplasma infection, which is the bacteria that's involved in walking pneumonia, it's an atypical bacteria and it does not have a cell wall that ceftriaxone or Rocephin, as we call it here, would be effective against. Yeah, there's always interaction issues with your antibiotics. So doctors will become pretty familiar with those. A lot of times we'll just ask them to hold other medications for a few days while they're taking certain antibiotics, and usually that suffices. We have some antibiotics that interfere with the lipid lowering agents, some antibiotics that interfere with antidepressants, for example. But a lot of times, as long as we know about it, we can advise the patient as to what the best course of action is. SIBO. For SIBO? S-I-B-O? I don't know what SIBO is, Robin. I'm sorry. Let's see, Suzanne. Thoughts on recurrent left elbow cellulitis? I do have bilateral lower extremity lymphedema, but not much swelling in the upper extremity. Chances are, if the area where you're having the cellulitis is right here, it's not cellulitis, but it's bursitis. Chances are. Another recurrent cellulitis is actually fairly rare. We do see some senior citizens with lower extremity issues with poor circulation that do tend to be more likely to get cellulitis. But if you have an elderly patient in your family who has swelling on both lower extremities and they go into the emergency room because they're red and hot and they get told that they have cellulitis in both legs and need antibiotics, be very, very skeptical, because that's generally not the problem. Typically, it is stasis dermatitis, simply inflammation secondary to the swelling. It can be a form of vasculitis that can also mimic a cellulitis. I had a gentleman who came in today who was in the ER on New Year's Eve, and his left leg was swollen, and he was told by the doctor that he had cellulitis. They gave him a shot of ceftriaxone, which is Rocephin, and put him on Keflex or cephalexin as an antibiotic, and drew some blood and sent him home. Then they called him back the next day and said that the blood test came back positive, and the doctor ordered, and I believe it was a doctor, I don't know if it could have been a mid-level provider, I don't know, but ordered a D-dimer, which was actually a smart move because it showed that they wanted to be sure that a patient did not have a blood clot. Well, here's the problem I have with that. If you're suspicious enough with a patient in an emergency room setting that you're going to order a D-dimer because you're concerned about a blood clot, it makes more sense to me to go ahead and just get an ultrasound. Ultrasound is not very expensive. It's not invasive. It's not very painful to push an ultrasound probe against that area. Anyway, to make a long story short, the D-dimer was positive, which is a blood test very suggestive of blood clot. They called him and said, you need to go get an ultrasound, but he didn't trust the ER anymore, so he waited till today, 9 days later, to come in and tell me this whole story, and he still had a swollen red leg. And I said, you have a blood clot in your leg? And he said, well, it's gotten a little better in the last couple of days. I said, well, there's a possibility your body has started breaking down the blood clot, but I need to start you on an anticoagulant. So I did. I started him on an anticoagulant, one of the NOACs, which are the novel anticoagulants, the newer medications that we have that are so wonderful, because before all we had were aspirin and, for the longest time, Plavix and warfarin or Coumadin. But I was able to put him on Eliquis. So I gave him Eliquis right in the clinic because I strongly suspected a blood clot, and send him for an ultrasound, which I'll hear back either on call. I'm not on call, but I'll either hear tonight. Somebody will call me, or they'll call me tomorrow. But I suspect he has a DVT. And so I'm already treating him. And I've already told him, I'm pretty sure you have a DVT and you'll need to be on this medicine for 6 months. And at the end of 6 months, we'll reevaluate your lower extremity with another ultrasound. If it's all cleared up, we'll take you off of the anticoagulant and have you take a whole aspirin every day. He was already supposed to be on a baby aspirin every day. He's not a very compliant patient, so I suspect he may or may some days have been on that baby aspirin, which is actually pretty good. So anyway, so sometimes these lower extremity problems are not handled correctly. Sometimes it's just difficult for doctors to really elucidate what's going on. So if you find yourself in that situation, question that diagnosis of cellulitis, because often that is not the problem. But it is possible to have a secondary cellulitis as part of peripheral edema, stasis dermatitis, vasculitis, thrombophlebitis, or just plain phlebitis. Hope that all sounded great. I made all that up. None of that's real. Only you nurses know I faked all of that. Yes, we add lidocaine to the Rocephin so that it doesn't hurt as much. It does give it a little bit of a burn, but it's not as painful. Small intestine bacterial overgrowth. Oh, okay. So that's what you were talking about. Okay. For SIBO. Okay. So you were saying, are you asking what's a good antibiotic for that? Typically for gut infections, I will use a combination of Cipro and Flagyl so we can get the anaerobic bacteria as well. Okay, DVT, exactly. Very lucky going 9 days. Yes, he is. The good thing is, and this is something that a lot of people don't know, but if you have a DVT that is below the knee, you have a less than 1% risk that clot will break loose and go to your lungs. So the risk was low, but it wasn't zero. Let's remember that. You want to compare the risk of having something bad happen. So he was probably 1,000 times more likely to have a problem with that DVT getting to his lungs than a child is from having a vaccine. So that maybe that puts some things in perspective, which is probably even 1,000 times more likely to happen than you getting 6 numbers right on a lottery ticket, which is exactly, let's see, less likely than getting struck by lightning twice. So you're more likely to be struck by lightning twice than you are to get the 6 numbers right on a lotto ticket. You're 1,000 times more likely to develop autism from a vaccine than you are to win the lottery. And you're 1,000 times more likely to develop autism than you are to have a DVT below the knee, break loose, and go to the lung. Don't quote me on those numbers. I think they're right. Okay, let's see. ER visits are a waste of time unless it's an MVA or something like that. Well, I think, Beverly, you make a good point. Emergency departments really are not designed to do primary care, but a DVT can be an emergency, especially if it's in the femoral vein. So I'm glad the doctor, the provider, did do the D-dimer because it got my patient at least back in to see me where I could get him the treatment that he needed. But I wish he had gone ahead and skipped the D-dimer and just done an ultrasound. We would have had the information right then, and my patient probably would be much further along on resolving the clot. Let's see. Your dad takes a low-dose aspirin every other day. I take a baby aspirin every day, and I recommend everybody over 40 take a baby aspirin every day for a number of reasons. And we've talked about this in some of my videos before, but everybody over 40 should take a baby aspirin every day unless you have a contraindication. If you have a reason not to take it, such as you have a bleeding disorder, you've had an aspirin allergy or other sensitivity to NSAIDs, you may not be able to take a baby aspirin. We're talking about 81 milligrams of acetylsalicylic acid, or ASA as it's abbreviated often, but it reduces your risk of heart attack, stroke, blood clots, pulmonary embolism, colon cancer, prostate cancer, and I think one form of female cancer, and I don't remember which one it was. I don't think it was breast cancer, but I think it might be endometrial or cervical cancer. No, I think it's endometrial cancer. But anyway, a baby aspirin a day is a good idea. And if you're going to have any kind of surgical procedure, you want to stop taking your baby aspirin a few days before. Yeah, 730 of them for $7. That's 2 years supply for $7. That's pretty cheap. Getting killed by a hippo is definitely not good. Karen, you lost me there. I'm looking. Somebody block Karen. I'm kidding. Don't. Beverly, any antibiotic can cause C. diff. Okay. Any antibiotic can contribute to C. diff. C. diff is Clostridium difficile. It is a anaerobic bacteria that is found in the environment and is often found in the gut of human beings. And if you have a suppressed immune system, or if you are on high-dose antibiotics, even sometimes for a short period of time, you can wipe out enough of your own healthy bacteria that allows C. diff to take off and start growing, and you can get a serious colitis, which can be fatal. My grandmother passed away at age 94 from C. diff colitis after being in the hospital for several weeks with pneumonia. She got over the pneumonia, but we could not get rid of the C. diff, so she passed from C. diff colitis. It was very, very unfortunate, and I still miss my Nana. She was a wonderful lady. No, let's see. I think we do prescribe Flagyl for C. diff in some circumstances. But C. diff colitis is better treated with vancomycin, oral vancomycin. Very, very safe. You can take oral vancomycin. It's very unlikely that vancomycin will cross into the bloodstream if you take it orally. So it's my go-to treatment for patients that are diagnosed with C. diff, or patients that I diagnose with C. diff. Let's see. Antibiotics. So we have to be careful with antibiotics. And you guys are bringing up a good topic here tonight, because I think we all agree that antibiotics are overused. It's amazing to me the number of patients that come into my clinic that woke up this morning and they're stuffy and congested and they're sure they have a cold, and they tell me they have a cold, but they want me to give them an antibiotic, and I have to talk them out of it, because that's not good medicine, guys. We don't do that. Let's see. Yeah, I'm not sure. I'm still lost about the hippo. You guys got me there. I'll put my face up so y'all know I'm not really a horse. I don't think we were really worried about that, Vanessa. You're allergic to most antibiotics, Mary Beth? That's interesting. I always find it interesting when I meet people who have a long list of allergies to antibiotics. I have found, and I'm not saying you, but I have found that most of them are not truly allergic to them, but they're just very sensitive to them. They don't like the way they make them feel. They develop yeast infections, or they get bloating and things like that. The chances of winning the lotto are less than getting killed by a hippo. Okay, I got it. I am with you, Karen. Thank you for clarifying that. All right, let's see. Doctors have been told to cut back on prescribing, and there are ads on the TV telling patients that most things don't need antibiotics, and trust their GPs if they say they are not needed. So here's the rule of thumb for me. If a patient has already been sick for going on their 4th day, even if I think it's viral, I will give them an antibiotic prescription and ask them not to fill it. And my logic behind that is if I can get them to hold on to it, 2 things happen. One, they feel like they got something. And in my business, a patient's got to feel like they got something, okay? And the second thing is they have a security blanket. So if they don't start feeling better a couple of days more, let's say they get on to day 5 or 6 and they're starting to notice their sputum is changing, they're starting to have fevers, their symptoms are changing, then they could be developing a secondary bacterial infection. And in that case, an antibiotic is perfectly appropriate. But I really walk a fine line there, because if I have patients that I don't give them something, then they feel they just go somewhere else. What they do, they'll just go somewhere else. Well, I didn't get better because you didn't give me anything, doc. So I had to go to the urgent care 2 days later, and they gave me some medicine, and I got better. So how does that look? The optics of that are terrible. It makes it look like I didn't give them what they needed, but they got it someplace else, when the truth is they didn't need it there either. They just happened to get better about the time that they were given these other pills, right? It's just like when somebody comes in with Bell's palsy. No treatment has ever been shown to shorten the course of Bell's palsy. But if you don't, as a physician, if we don't put them on an antiviral and give them a steroid pack, somebody else will. because what's going to happen is they're not going to get better right away. You will have told them that this will get well on its own if it's going to get well. And they'll go see somebody else and they'll get started on a steroid pack and they'll get started on either Valtrex or acyclovir and they'll start to get better. And then the next time you see them, they'll say, well, you didn't give me what I needed. What I needed, I got from someone else and I finally got better. So we won't talk about that. And so you learn, okay, so somebody has a Bell's palsy. If I don't give them those medicines, somebody else will. And then they lose the confidence that they have in me as their physician. And I have a problem with that. And I don't know how to beat that. If I had a way to beat that one, I would. I can tell them, I can talk to them blue in the face and tell them this will get better on its own. But if I don't give them something, they're going somewhere else because everybody in their family is going to tell them, no, that's not right. They're wrong, but that's what they're going to hear. Let's see. Just about every time I get a cold, I end up with a sinus infection, respiratory infection, or both. Thankfully, amoxicillin works pretty awesome on me, which I guess is a pretty mild one. It is. They can't do that here. Let's see. 25 years ago, I kept having recurring bladder infections. I had to take antibiotics for a year once a day. I do that too. I have some older patients who have, especially ladies, who just simply continue to get urinary tract infections for a lot of reasons. A lot of it has to do with not getting enough water. They don't drink enough water, or they're on medications that cause them to not feel thirsty, and they don't drink enough water, or they're not able to completely empty their bladder when they go. And so they continue to get these recurrent urinary tract infections. And so for them, what we'll do is we'll put them on a daily nitrofurantoin tablet or a daily sulfamethoxazole tablet. And it seems to do very well for them. And also individuals with indwelling catheters. So someone who's had, for example, a spinal cord injury and they can't feel the urge to urinate, instead of them having to wear a diaper, which can lead to all kinds of skin breakdown issues because they just don't feel anything below whatever the level of the spinal cord injury, they'll actually get an indwelling catheter placed. Well, most of these, if they're done properly and they're cared for well, they don't get infections, but some of them do, and they get recurrent infections on a very regular. Where I've had these patients come in every 2 weeks to 10 days with another infection, and so for some of them, we have them just take an antibiotic one a day to prevent, and it works for them. Also, I have some young ladies that we give an antibiotic to have on hand for after sex. To take a pill because they have a propensity to developing urinary tract infection after sex. So I give them an antibiotic to take one pill after intercourse, and that seems to work very well for them. Let's see. Real Ruler, extremely hard, deep, racking cough frequently after colds. Several times I've taken antibiotics and the doctor examined me saying the infection was gone. Yet, well, it's possible that you can have allergy symptoms that will mimic a cold and give you a deep cough. It's also possible that the infection can be gone, but the healing hasn't occurred. For example, I have, if a patient has pneumonia, for example, like the gentleman I sent over today to be admitted to the hospital with bilateral lower pneumonia, even when he gets out of the hospital in a few days, and let's pray that he does, that even when that happens, he's not going to be well. He may not need an antibiotic anymore, but it's going to probably take him a good 4 to 6 weeks for him to get his wind back, for him to get his energy level back, for him to get his health back. So he still has healing to do. So it's possible if you're getting sick and yet after, a period of time and you're seeing the doctor, yet you still have this cough, but your doctor is telling you don't have an infection anymore. They're probably right. You just haven't gotten well yet. I'm going to back up. I've lost some questions. Vi, hi, nice to see you. Cough continued, seems to get better very, very slowly, but only after several weeks to a couple of months later. Need Tussinex to control the cough enough to sleep. So you may have a sinus problem. You may have a mechanical issue or a blockage in one of your sinuses that's causing you to continue to drain. And so even though you don't have an infection, you may have a lot of congestion that's leading to coughing. So that would be my, without actually examining you, Ruler, I couldn't tell you more. Why don't they just get up and use the bathroom after? You know, that's a great, and some do, but yet they still seem to get they get it. We call it honeymoon cystitis. Beverly, allergic to penicillin, all the cillins. So if you say penicillin, we include all of them. And sulfa, you get full body rash and hives. Those are true allergies, yes. But that's only really, I would only consider that 2 allergies. That still leaves you a lot of antibiotics that you could still use. James Bland Show. Last time you came on, we were just leaving. So it's good to see you and your show. Hope the show's going well. Tussinex is now a category 2 or a class 2 medication here, so it requires a triplicate. So we tend to stick with the Phenergan with codeine, except for those with a codeine allergy, and then we'll use the Tussinex. Tussinex is 1 teaspoon every 12 hours for cough. Robin, are you leaving? Good night. Thanks for stopping in. Try Sue's medicine drink. Does she have a medicine drink? Cool. Need to check that out. I have a little medicine drink here. It's called bourbon. It's very effective. Let's see. Yep. Hi, Beverly. Yes, that's right, Ruler. So sometimes, even though the infection is gone, the body still needs to heal. Let's see, Brenda. Sex got your attention. Okay, let's see. That was your problem. Kept getting bladder infections after sex. Best thing to do, go into the bathroom, take a warm wash rag to wash yourself out. Problem solved. I haven't had another one since. Okay, so yes, that can work. Inflammatory response after sex. Kristen, writing down bourbon. She's good. Thank you. Dextromethorphan is over the counter here. Tussinex, if it's not abused, is a very fine cough syrup. It's just that a lot of doctors don't want to take the time to have to go get a triplicate pad and write a prescription for a cough syrup that is then going to be monitored and regulated by the government. Whiskey, honey, and lemon make an awesome cough syrup. Yes, they do. Didn't wash, just peed. TMI. No, I tell the young ladies that are coming in with urinary tract infections, we have a frank discussion about making sure that they wipe correctly, that they urinate after sex, and that after they finish voiding, I like to say, count to 10. And what? Somebody tell y'all know, have you heard this? Count to 10 and then do what? If you know what the rest of the saying is, write it down. Tell me if you know it. I'm curious if anybody else has heard this before. Tell them 3 things. Wipe the correct direction, front to back, not back to front. Pee after sex. And then what's the other one? Count to 10 and do something else. Count to 10 and go again. That's right. Count to 10 and pee again. That's absolutely right. You guys have heard that. I was curious. Used to work for an OBGYN surgeon, and women called all the time for the morning after pill. Ugh. Now in New York, they sell it OTC. She also said, do not douche. Yeah, we don't recommend douching. It's just not recommended. I have to do both. Doctor actually told me once that I may be slightly allergic to semen. Don't know if that's true or not. It is possible. The only problem with Tussinex, in my view, is that the insurance doesn't want to cover it. Thanks to you, though, I found Walmart has it for $27 via GoodRx. It's always good to know that we've helped somebody find a good way to get their medicine cheaper. That's wonderful. Good. What do I think about the new KY gels? I think that as we get older, ladies, we get drier. We ladies get drier, and I think the KY gels are just fine. I think it makes relations more comfortable and more enjoyable. What's my opinion on melatonin for sleep? You can't get melatonin in the UK? Really? Wow. Okay. So my opinion is that melatonin does help some people. And I don't have a problem with people taking melatonin. I have some people that take it every night to help them sleep with no problem whatsoever. The biggest issue that I see with melatonin is that people don't take enough of it. So I'm surprised. I did not know that was not available in the UK. Interesting. Very interesting. Yeah, it's sold right over the counter here, so I'm surprised to hear it's not for sale there. It doesn't help everyone. That's right, Beverly. Why can't you get melatonin? Yeah, there we go. We don't know. Smallest dose and you're groggy for 16 to 18 hours. Wow. I'm curious what your dose is, Ruler, because sometimes some of the doses are much different than others I've seen in melatonin. There's a lot of variability. Debs is asking how much you should take. You should take the amount that you need to help you fall asleep. You really can't take too much. So you start low and you try one pill in the bottle, and if that doesn't do it, try 2. If that doesn't do it, try 4 the next night, and go to 6 if you need to. If you get to where you're taking 10 or 12 or whatever melatonin and it's not helping you, then it's probably not going to help. Wow, Karen, that's a rough Tussonex story. Do you have problems with other forms of hydrocodone? Hurts. I presume you mean sex. Since your total hysterectomy, I just don't want to, and neither does he. It sounds like you have a wonderful relationship then. 12 milligram would be perfectly okay, Vanessa. That's perfectly fine. See, Shelly, my GP asked me to get my sister to send me some over as I was reluctant to take sleeping tablets. I took what my sister sent me, and my doctor told me to half the pill. Wow, maybe we need to get a little black market melatonin deal going here. I could probably get a box of it to somebody. You think we can make some money on melatonin? We'll have to relabel it somehow. We'll call it aspirin, or we'll call it vitamin B or something like that. But secretly, it'll be melatonin, and we'll go into the melatonin importing business, we'll call it, as opposed to the smuggling business. I'm seeing a great opportunity here for you folks in the UK. It's interesting, Suzanne, that's really interesting to me. Pharmacists in some places do have the ability to do some prescribing. And I really think it's interesting. Yeah, vitamin M. It's a new vitamin, the vitamin M. It doesn't surprise me, Shelly. As soon as you tell people they can't have something, they're going to want it. Melatones. If it makes you itch, don't take it. That's what I say. Everybody does deal with medicines differently. So I have people that I give a prescription to, and they tell me, well, how is this going to affect me? And I can say, well, common side effects include X, Y, and Z, but you may get none of those. You may get all of them, or you may get something very rare. And I have some people that get a prescription, and this happens actually a lot more often than I like. They'll get a prescription and they go look it up online, and they get all the way to the bottom of some, dramatic article about all the potential problems that 1 or 2 people had. And so they don't take the medicine, and then they come back with the same problem. And I ask them how they do with the medicine. Oh, I didn't take that stuff. That was way too dangerous. Well, you didn't take the medicine. Well, I don't want those side effects. Well, you don't know that you're going to get those side effects unless you take the medicine. Well, I don't want to take the risk. Okay. I mean, you don't want to take the medicine. Don't take the medicine. Don't take the risk. Don't get in a car. There's a risk that you're going to have an accident. I mean, everything has a risk, right? Okay. We're getting a little TMI on some of this. Yep. Okay. Sex isn't everything. Always laugh at the side effects from the drug ads on TV. There've been a a lot of parodies of medication ads that just go on and on about the side effects. Vanessa, you can't be telling somebody that may not be having the right kind of sex. I'm going to get embarrassed. Well, the side effects of some medicines do include death. Yeah, and that's just like saying, well, you know, if you're having a certain kind of problem after sex, you may not be doing it right. I suppose it's possible. Yes, you don't get drug ads there. And I wish that we did not have pharmaceutical advertising legal here. I wish we did not, because I think it causes more problems than good. I really do. I think there are some people that go after, once they find that they have, that there is a solution or a medication for their problem. There are some people, after they've seen a pharmaceutical advertisement, they will go seek that medication. And it may or may not be the right medicine. And if it's not the right medicine, sometimes that causes a little bit of a conflict with the physician. But if it is the right medicine, then the ad helped them. But a lot of times, people come in for the medicine, and they don't need it. I've had people see advertisements for restless leg syndrome medications and come in because they're having leg cramps. Well, they're not the same thing. They thought they were the same thing. Well, they're not. Blah, blah, blah. You may experience stroke, heart attack, bladder dysfunction, gas, diarrhea, aneurysm. So why not take the pill that makes your skin look clearer? Absolutely. I think the ones that get me are these guys that come in and they've listened to all the advertising on the sports radio shows about low testosterone, and they keep getting encouraged to go get their numbers checked and come into the low T center. And unfortunately, I just had to discharge a patient the other day because he was abusing testosterone. 6 days after he'd gotten his testosterone injection, his testosterone level was almost 1,400, which is about 4 times normal. So he was clearly taking too much of the product. And we discharged him because we knew that he was abusing the testosterone. So yeah, lots of medications can be abused. No question about that. You had a 24-year-old girl pass away here 2 weeks ago from mixing too many OTC meds. I wonder why she was mixing them. I wonder if she was sick. Was she sick, you think? Or was she just really trying too hard to be healthy? That is very sad. That's sad. Yeah. Yeah. Very sad. Well, let's talk about something more interesting. I don't want to be sad right now. I want to be happy. I'm having injections in my neck tomorrow. High up. I'm getting some pain right up here, the occipital nerve, right? So I'm getting some headaches. I think it's related to the fact that I'm moving different parts of my neck now than I was before. So I'm going to try a nerve block. If it works, I'm going to come back in a few weeks and do stem cell injections in that area. I have a lot of arthritis, a lot of degenerative changes in my neck just due to, the chronic issues that I've dealt with over the years. And I'm looking forward to hopefully that this will help. Although the tremors are almost completely gone, I'm just really so blessed to be able to use my hands again, and I'm not dropping things. The strength is coming back. It's just so gratifying to see that last surgery has helped me so much. But I am getting some headaches. They're manageable with Tylenol and heat. I did talk to my pain management guy, and I am scheduled tomorrow for 3 o'clock, and the DW is going to come and drive me home. So let's see. Medical channel on YouTube video where a kid ate a bunch of gummy bears. Unbeknownst to him, they were vitamin gummies, and he ended up with extremely fragile bones. That I'm really skeptical that that's true. Not doubting you, Ruler, but that doesn't sound. Even if you had a whole bottle of them, that would be extremely difficult to do. Yeah, thank you, Kristen. Very glad to see your tremors. Yes, thank you, Ruler. I appreciate that a lot. Yes, I really feel like it's doing well. I felt great all day today. I'm doing well just with a little Tylenol and occasional Aleve. So I'm very pleased. I'm very hopeful that I'm going to be able to practice for many more years. Your sister works at Tomball College, and since she broke, let's see, we live in the country, driving past one of the fields, kind of getting dark. And a shout out to my kid, Dingoes. She's like, Dingoes where? Lost me. That's lost on me, Vanessa. Yeah, that is sad though. Sometimes they work, sometimes they don't. It depends on it depends a lot on the skill of who's doing the person doing the injections. Okay, let's see. Broke her ankle. She's been off for 6 months, physical therapy, but still in a lot of pain. How long? 6 months for a broken ankle? Did she fall off the roof? What happened? $150 gummy vitamins for breakfast. Well, I think you could make yourself sick, but I'm not sure why that would give you brittle bones. That's really interesting. I'll look that up. That's interesting. See if I can find it. You think, yeah. So I've never seen an ankle injury from, stepping in a hole or a twist or a sprain that lasted. I take it back. I've seen high sprains go on for 6 months, but fractures typically do not go that long. Usually 2 to 3 months at the most, even with therapy, and they're usually right back to normal. She really thought there were dingoes. Okay, so you were kidding with her. Got it. Massive break. She had to have surgery and broke both sides. I think that she's expecting too much. She could not drive. Yeah, I imagine not, especially if it was the right foot or the left foot if she drove a standard. But I don't think anybody drives a standard anymore. Beverly, you've had a lot of injections, haven't you? Isn't a dingo like a wild dog? Kind of a wild dog? Like we see kind of a lot like coyotes here. We have coyotes, but I thought the dingo was a wild dog. Yep, trying to lighten the mood. Just don't eat 150 Haribo gummies or you'll in the toilet for weeks. Yeah, well, that may be true. Wild dogs in Australia. I thought so. Still drive a standard Ford Ranger. Well, that's amazing that one of those is still on the road that long. Wow, 42 injections. That's a lot. I've had a number of neck injections, but nowhere. I don't think I've had more than 10. I've had a lot of them though. Yeah, that's a lot. Man, we've gone on for an hour and 15 minutes. You guys are just, man, chatting just goes by so fast. Dingoes in the U.S., Carolina dog. They're AKA American dingoes. How interesting. I've always liked Australian Shepherds. I had an Australian Shepherd years ago. Wonderful dog. A little red-coated female. She was fantastic. Her name was Ginger. She's a great dog. You posted a review on Amazon, and the summary was intestinal exorcism. Great. Yeah, I mean, it sounds like she had a significant injury, Shelly. Wow. I wonder who her doctor is. Wonder, do you know what the name of her orthopedic doctor is? I'd be interested to know. Not bad, Kristen. They won't give me, yet they won't give you pain meds. That's unfortunate. And nobody should suffer in pain. Yeah, I think Australian Shepherds are great. I mean, they're just natural herders. They're awesome dogs. I love them. I have an Australian pet too. Wait, it's my husband. That's a good one. What do you call well, okay, Deborah. A bulldog and a Shih Tzu. Bull caca. That's my answer. I'm on pain meds. They don't help a lot. Trying a new program soon through my insurance provider called Naturally Slim. Learn how to lose weight by changing how you eat instead of what you eat. There are a lot of programs like that that doctors receive. I'm not aware of any that have been promoted by their insurance provider. I think that's interesting, though. I think anything that helps people learn how to eat is probably a good idea. Let's see. Dog herds his kids. Yeah, his dog. I mean, they're just natural herders. It's fun. They'll round the kids up. That's what ours did. Let's see. Get that for me. Let me know. I'm curious. Spoke very highly of him, and he's in Tomball. There are some very good ones. There's also a couple of sore heads in Tomball when it comes to bone doctors. So, intestinal exorcism. That's what I'm calling my IBS from now on. Maybe not intestinal exorcism, but how about, let's see, intestinal demon possession. How's that? Exorcism would be getting rid of it, right? Just love my jokes. I sometimes put in my videos. I got to, let me see. Oh, yeah, that's, I figured that one out, Deborah. Dachshunds are good dogs, or dash hounds, if you like to call. I've heard it called both ways. But they're dachshunds to me. They're loyal dogs. If you're in the mood for lowbrow comedy, look up LA Beast Haribo on here. His review is priceless. Okay. What did one candle say to the other candle? What time are you going out? Good. Beagles are sort of the quintessential family dog, right? They've got that look. They're lovable with the big sad eyes and the long ears. It's just hard not to love a beagle, right? Beagles are awesome. Charlie is a cockapoo, half cocker, half poodle. And she is a diva. She refuses to get into the grass to do her business. Half the time we have to carry her out into the grass. 5 beers, please. Got it. Rough Collie, Cavalier, King Charles, and a toy poodle, Border Collie, a pointer, and a mutt. Sometimes mutts are the best, though, you know? I had a couple of mutts when I was younger. Hey, Teresa. Nice to see you. You had a Yorkie for 20 years. By the way, I'm curious, have you guys had any little pop-up videos? I mean, little pop-up ads on the bottom? Have you had to click some of those off? I'm just curious. No, good. Okay. Shepherd Roddy mix. Interesting. No. Okay. I better turn those on, huh? I should donate some money to myself. It'll be interesting to see how do birds learn to fly? I think they just get pushed out of the nest. I think they are born knowing how to fly. They just wing it. Good. Man, corny jokes are just the best. Guys, I think I'm going to call it a night. It is 10 till 9. I'm going to go in and visit with the DW for a little while and talk about our plans for tomorrow and all of that. And I appreciate you hanging out with me. I have another joke. Why did Dracula go to the doctor? It has to do with blood. Not sure. First dog was a retired hearing ear dog. Interesting. Where can you email? Here's my email address, Shelly. Put it in for you. Couldn't stop coughing. Good. Don't let the bed bugs bite. All right, you guys are awesome. Love you all. Thanks for hanging out with me, and I had a great time tonight. And let's do it again soon. I'll let you all know how the injections go, or the DW will, or I'm sure, or something. Maybe she'll even make a little video of me gritting my teeth and having a large needle shoved into my neck a couple of times tomorrow. All right, guys, y'all take care and tune out. My advice is to tune out on the politics. Tune in to loving each other and taking care of each other and doing the stuff that really matters, right? All right, that's all for now. We'll see you next time. Bye.